Hello and welcome to the sixth episode of Educhat with Dr. Sujit. I hope you're enjoying this journey because I'm really enjoying it a lot. I'm receiving so many questions and I'm so happy that you people are getting your answers. You are asking more questions and I want you to share this video with more and more of your colleagues and friends so that everybody gets benefited into their own practices. So we are here at the sixth episode of Educhat and I'm sure you know it already that the one who asks the best question is going to get the free copy of my international bestseller book, New Age Dentalpreneur. So keep on asking very powerful questions which will help not just you but to everyone who is watching this series of Educhat to grow their practice to the next level. Subscribe to my YouTube channel if you have not done it already. And today I'm going to answer 4 questions in this episode. So the voice of the question for the day is Shivani behind the camera. So Shivani, what's the first question today?
Dr. Jyotsna has a question for you. Can we give options to the patients for cheap and expensive treatment?
Okay, so the question from Dr. Jyotsna is about cheap and expensive treatment. Now, Dr. Jyotsna, let me tell you one thing. Never give any option to your patients about cheap or expensive. Now, I'll tell you what does it mean. Okay, it actually conveys a message that your practice has got 2 treatment options available and one of them is cheap. That means you do cheap treatments in your practice. And I'm sure none of the practicing dentists, including you, would like to project or portray your practice that this practice has got cheap dental treatment options. I think the better word or better way to frame this question and better way to promote it to the patient is we have different treatment options available. So it's not about cheap or expensive. It's about like we have different type of crowns, different type of filling materials, different type of implants, and as per the patient's budget, as per the patient's health requirement, whatever is best suited for the patient, as a dentist, you are supposed to advise that to the patient. So never use this word. I'm not saying you are using it, but then never project your practice as if there is a cheap option available. Okay, trust me, it's better to be expensive than to be cheap. Right? So I hope you got your answers. So we can have different options and we do have different options already. But then don't make that brand perception, that brand image of your practice that there is a cheap option available. Right? So there are different options available. None of them is cheap. Right? So Shivani, the next question.
Dr. Akshay Patil asks, many dentists are practicing skin and hair treatment in their dental practice. Your views on it?
Okay, so Dr. Akshay Patel from Gujarat has asked this question. A lot of dentists nowadays, and I'm sure all of you agree, that there's a trend which is going on. A dental clinic clubbed with skin or laser or hair clinic. Now, if there is a collaboration where a dentist is practicing in the same premises along with a dermatologist or a cosmetologist, then it is fine. But frankly, as per the rules, as per the code of ethics, dentists are not allowed to do any skin procedures. Okay, this is the domain of dermatologists. So although we all can get the temptation of going with the trend or maybe grabbing that opportunity and trying to get your pie of cake, but my honest suggestion is never do anything which is not legal and not ethical. Because if the foundation of your practice growth is built on illegal or unethical or incorrect things, eventually, no matter how big it goes, it is going to collapse someday or other. And I'm sure as a practicing dentist, none of us wants that. Now, the only procedure which is like okay or allowed is hair transplant, and that too only by the MDS oral surgeons. So unless there is an oral surgeon in your practice who perform this, or if you are an oral surgeon who have this facility, you have the domain expertise, you can go ahead. But frankly speaking, a dentist is not allowed to do any hair transplant and any skin procedures as of now as per the DCI. Okay, so take care of this. There's a very thin line that separates temptation and moral discipline. Remember, Temptation is like, we all can surrender to the temptation, the trend, the opportunity which we see around us in the field of cosmetology. However, the moral discipline says that it's not that you don't get tempted, but you do not surrender to your temptation. And trust me, dentistry has got more than enough number of treatments and treatment options which can take your practice to literally 5-10 folds growth. Focus on dentistry. There's a lot out there if you do the right things in the right way. All the best to you. So the next question, Shivani.
Dr. Rahul Sinha asks, how do I automate my own dental clinic practices so that I can spend stress-free time with my family?
Okay, work-life balance, want to spend more time with family. Automate the practice. That means at the same time, do not want to lose on the income side. Very interesting. So Dr. Rahul, I'll tell you something. Every practicing dentist would like to have this kind of practice. I'm sure it's a dream practice for you as well. That the practice is on automation, you're making money, at the same time you're going on vacation with your family, spending more time at home, maybe spending more me time. We all would love to have that. And it's not that it is impossible. But the point is, you need to move from hard work to smart work in order to make it happen. And you know what's the secret of smart work? Every road to smart work goes through hard work only. Now, how to do that hard work and where to start? It all starts with beginning, the initiation of your practice. I always say this. There are 4 stages of any dental practice. Initiation. You start your practice. You yourself take charge of everything. Whether marketing, whether soft skills, whether patient consultation, whether treatment, whether management of your practice. You take charge. You become better at it with every passing day. Keep on upgrading yourself. Keep on becoming better at it. Once your practice goes to the stage of stability, where you are making now enough money to cover all your expenses and overheads, and then you are also gaining some profit, you are able to keep some profit or some money aside, do that saving, do that investment. So once after a few years your practice settles down, the next stage of your practice is the growth or the acceleration phase. So the first phase is initiation. Second is acceleration, where you already have a patient base now. Okay, and now those patients with the word of mouth sends more patients to your practice, and at the same time now you know better about digital marketing, offline marketing, socializing, networking, website, SEO, and when you do this marketing part, your practice grows even further. So this phase of acceleration takes you to a very good level where you can save handsome money at the end of every month after your expenses and liabilities. So your savings increases to the next level, your investments increases to the next level. And you have to move from maybe a single chair practice to multi-chair practice. And once you do that expansion, then comes the third phase, and that is delegation. Build a team, develop that leadership and management skills. Build your team. Once you build the team, slowly start delegating the work to your team. Improve on their commitment, improve on their competency. And once you develop that system where everybody in your team know what exactly their role is, how they are going to play it, how you are going to supervise everything, how you are going to manage your practice, then comes the stage of automation. So automation is possible, but not easy. Every road to smart work goes through hard work only. And the stage of automation should be, in my opinion, the ultimate aim of a practicing dentist. That doesn't mean that you don't do dentistry at all. You only do your favorite procedure, whatever you are really good at, whatever you really enjoy doing it. But apart from that, everything else is delegated. And there are days and weeks when even if you are not there in your practice is not just functioning, but even growing in your absence. That's the ultimate stage of automation. And if you can make it happen in your practice, you can really enjoy your life. See, if working hard and making money is important, enjoying that life and enjoying that money probably is even more important. Growing that money is probably even more important, right? So go through the stages of initiation, acceleration, delegation, and then automation. And we all will be able to do it if you know how to do and how to develop that system. All the best to you. So the last question of the day, Shivani.
Dr. Mangesh asks, can we start second clinic where there is no other practicing dentist if first clinic is not profitable?
Okay. Starting a second clinic in a place where there is no competition, where there is no other dentist, and especially if your first clinic is not profitable. Now, Dr. Mangesh, my frank suggestion that always remember one thing. Now, there are two questions in this. First practice is not profitable and starting a second clinic where there is no competition, no dentist. Okay. Now, if I answer you the first thing, dental practice being not profitable, honestly speaking, you should work on yourself and your practice more than shifting your place. Because I'll tell you what, no field or no area, no vocation, no business profession is not profitable. Okay? Provided you do what you are supposed to do. I say it so many times, dentistry is all about 3M. The marketing, management, and professional mastery. So if you want to build a profitable dental practice, you need to focus on the marketing aspects. Irrespective of wherever you practice, the online and offline marketing are integral part of any dental practice nowadays. The management, that is soft skills. You become better at communication skill, patient consultation skill, presentation skill, management skill, leadership and interpersonal rapport building skills, and crisis handling or complication handling skills. Now, these are all human skills. The good news is all these skills can be learned, can be acquired. They are not inborn. And as you become better at patient consultation, rapport building, interpersonal skills, you will have better patient experience. You will be able to do a better connect to the patient, with the patient, and your practice will naturally grow. And the third is professional mastery, that's clinical skills. Keep on upgrading yourself all the time in soft skills and clinical skills so that your practice goes to like 2, 3, 4, 5 times within just a couple of years. And yes, it is possible. It has happened for so many, thousands of my course participants. So there is no reason why it should not happen to you. And as you focus on these 3 M's, then you will have a practice where probably you won't even have the thought of shifting to some other place. Because I'll tell you what, now coming to your second part of the question. If you want to shift to a place where there is no dentist, I'll tell you, you might be able to enjoy that monopoly advantage or that first movers advantage maybe for a few months or maximum a couple of years. And if in that place, your dental practice starts functioning very well, there is always a smart dentist around who will understand there is a lot of scope there. And the moment that, one more dentist join the party in that place with you, your practice will start going down again. So it is not about the places. It is not about the fields or professions that makes you successful or not. It is all about you. What you do, and most importantly, how you do in whichever business professions. No business profession is bad, not profitable. No vocation, no business profession is like that, and no place is good or bad. I always say this, people make places, places do not make people. Okay, so focus on you yourself, focus on your practice and become a better version of yourself every passing day, so that there comes a point where you don't even have to think about shifting your practice. And even if you start your second clinic and then third clinic, you will still be able to do it very efficiently and successfully, and most importantly, profitably. All the best to you. So with this, we come to the end of the 6th episode of Educhat with Dr. Sujit. I really enjoyed answering your questions today, and now is the time to pick the best question of the day. And the best question of the day that I liked was from Dr. Rahul Sinha. How to automate the practice and spend more time with family and go on vacation and all. Because it's a wonderful feeling to have that kind of practice, right? I'm sure everybody dreams to have that practice. Congratulations, Dr. Rahul. So you are the winner of the free copy of my international bestseller book, New Age Dentalpreneur. Our team will soon get in touch with you and to get your shipping address. So grab your copy, enjoy reading, happy reading, and keep learning and move this through these 4 stages so that eventually you automate your practice. Thank you everyone for watching this video, and I'm sure that you enjoyed this. Subscribe to the YouTube channel, share it with your friends, and I'll see you in the next episode of Educhat with Dr. Sujit. Thank you.